Hi, my name's Jed Morton. I'm a research fellow at Monash University. My postdoctoral fellowship with the Heart Foundation will look at building an evidence base to justify the shift from short-term primary prevention of cardiovascular disease to long-term primary prevention of cardiovascular disease. Now, what do I mean by that? Well, the current approach to primary prevention of CVD is usually to calculate a 5-year risk of an event. The problem with doing that is that usually it doesn't recommend intervention to lower risk factors until far too late in the pre-disease trajectory. Despite the fact that many risk factors for cardiovascular disease like cholesterol and blood pressure can be elevated and causing damage to the arteries much earlier in life than these risk factors would recommend intervening. But there is no specific tool yet that can tell us how much benefit could be gained by intervening earlier in certain individuals. So I want to use my fellowship to build that evidence base. I'm going to build modern epidemiological models to incorporate disease biology and build a personalized lifetime risk calculator that can tell any individual at any age what their remaining lifetime risk of CVD is. And more than that, what would be the best risk factor or risk factors to target for that individual in order to lower that risk. And then use that risk calculator to build an online web interface so that it's freely available for clinicians and the public to use.